In Honduras, the nutritional information for young people is limited and scarce. To collect this kind of information helps us to create different proposals. And with these proposals, help these communities when they are found at nutritional risk. This is the reason why the main objective of my project was to determine the pattern consumption and the nutritional state of young people between 30 and 17 years old of San Antonio Oriente High School, located in San Antonio Oriente, Francisco Morazan, Honduras. The collection and data analysis take us 3 months. At the end of this period, we are able to realize that this population is a nutritional risk because we found deficiencies in micronutrients, just like the iron, and by the prevalence of anemia, especially in females with a 30% and with a 60% in the total of the population.
There's a lack of information about the nutritional state of older adults from Honduras. Due to that, the objective of my study was to determine the nutritional state and to determine the prevalence of metabolic syndrome in adults from 65 years old and more from El Jicarito area. We work with adults from different villages from El Jicarito area. We found that most people didn't fulfill the nutritional recommendations and they present a high prevalence of blood glucose and a blood pressure. It is necessary to develop complementary foods in order to fulfill the nutritional requirements of this population.
Food composition database are a useful tool in order to determine food labeling and the nutritional intake of a population. Unfortunately, it does not exist a food composition database that contains all the nutritional information of the foods consumed in Honduras, so there is a limitation in the estimation of nutritional intake of the Honduran population. Fatty acid profile, it's a very important information about the fatty acids contained in some food. So, my objectives were to determine the influence of updating the fatty acid profile of the foods consumed by the adults in a Jicarito area and watch the effect that they have on the means of consumption of fatty acids. The results of my study was that the update of the fatty acid profile had a significant effect increasing the estimation of saturated and monounsaturated fatty acids and decreasing the estimation of polyunsaturated, omega-3 and omega-6 fatty acids, demonstrating the significant effect that adding the fatty acid profile of a food composition database has in order to have a more accurate determination of nutritional intake of the Honduran population. So thanks to the support of the Institute of Technology in Healthcare, valuable information of the nutritional situation of the Honduran population was achieved. With this information, decisions for positive interventions can be taken in behalf of the Honduran population at risk.